So welcome, Professor Judith Mackay. You have such a stellar and long-standing presence in this field. And I wanted particularly on this visit to ask you about the Hong Kong government, the approach they're taking to tobacco and related products, and how that's going.
Well, I also have a very long-standing association with Scotland and with ash, because actually in the very early days when the Hong Kong government started to take action, it was very much promulgated by my connections with the Croftons, who were at ash in the first place, and also ash in London, David Simpson in London. So what happened in Hong Kong was, because we were then a colony, a British colony, we tended to follow the British system, and so if there was an anti-smoking policy, then Hong Kong would de facto almost adopt it as well. So we were very fortunate in the late 70s and early 80s of getting cracking early, way ahead of many of the other Asian countries. So we were lucky in that respect, and we started passing laws and doing health promotion and setting up a council of smoking and health. And in the early days it was very much focused on health, and then of course it moved into what you do about it, in other words action, the legislation, the taxation. And now I think we're very focused on the tobacco industry and the realization that tobacco control will never be achieved unless governments address tobacco industry interference. So that's been the sequence over the last 40 years in Hong Kong. And an example of what we've done recently, of course, is to ban manufacture, importation and sale of the e-cigarettes and the heated tobacco products and herbal cigarettes, just to get all three in one go, so to speak. So we banned those a couple of years ago, and that's been extraordinarily successful. And again, that was with the help of Scotland. A colleague of yours, Garth Reid, who was working with the government, came out and was part of our international sort of group advising the government. And so we banned it as a preemptive strike. We just simply felt that we didn't want to let the genie out of the bottle. We didn't know what the ingredients were. We didn't know, does it help smokers? We didn't know what effect it would have on children as a sort of entry drug. We just had no idea what would happen if we allowed it on the market. So we decided to do a preemptive strike and ban it. And we're along with 40 countries in the world that have now banned it. So England and New Zealand and Canada are very much actually out on an international limb, having embraced, I would actually use that term, embraced e-cigarettes. And I think the most important thing, just to conclude this answer, I think the most important thing is in Hong Kong we have got our prevalence figures under 10%. 9.3%. And I think what Hong Kong has shown is you don't need e-cigarettes to bring your prevalence down. We've had no e-cigarettes on the market, and yet our prevalence is down in single figures. So I think that's the one thing that the tobacco industry really, really dislike about Hong Kong, is that we have shown you can bring smoking rates down without using e-cigarettes.
And I imagine the industry fought tooth and nail against that sort of decisive precautionary action.
Absolutely. In fact, a veteran legislator in Hong Kong told me that in all his decades in the equivalent of Parliament, in all his decades in the legislature, he had never, ever seen lobbying to the extent that he did over e-cigarettes from the industry. And he said he didn't just mean tobacco, he didn't even mean on a health issue. He meant ever. He'd never seen the intensity of lobbying. And our own government is on record of saying that, for example, our health minister was threatened on an almost daily basis by the tobacco industry. We had a very, very tough battle. But again, if you apply the scream principle, that the industry screams if something's going to really work and be effective, then my goodness me, e-cigarettes are the issue over which they will fight tooth and nail around the world, in fact, and try and prevent the kind of legislation going through that Hong Kong has.
So what kind of arguments was the industry using to oppose regulation in Hong Kong?
It was, first of all, they said it was safer. They used this mythical 95% safer than cigarettes, which we did not believe for a minute. So they said it was safer, that it wasn't fair on smokers, that they had the right to have access to a better way of quitting smoking, against freedom of choice, against all their own commercial initiatives and everything. I mean, they used the whole works, really. And they tried to discredit people like myself on the other side as well, not just the health minister.
The industry has the resource to throw a lot of arguments against this kind of thing. Have you seen that globally, that this has become a real issue for the tobacco industry?
Oh, heavens, yes. I don't think any country now can try to do what Hong Kong has done without, at minimum, a visit from the tobacco industry and stroke vape industry, stroke nicotine industry, all basically the same in my book. But they can't really get a law through without considerable pressure from the tobacco industry. And many of the people in Europe and in North America who are still supporting vapes as the way to go. I mean, they are not just working within their own countries, they're coming out, and we had so-called harm reduction experts from all over the world come and visit us. They did press interviews, they tried to have access to government, they really tried to prevent that. They made representation to Legislative Council. They really tried to prevent this law going through. So as I said, if you follow the Screen principle, then that's every country should be banning e-cigarettes from a future point of view.
And China, I think, initially had a market that it then reined back in. Could you tell me a little about what happened there?
Well, most of the vapes are made in China, so there is a commercial aspect to all of this, which one cannot ignore. Yes, they came on the market, and then China realised that they were unleashing this sort of new form of tobacco on a market of over 1 billion people. And so they then tried to do incremental steps. They have tried to ban vaping in smoke-free areas, the traditional smoke-free areas. They have tried to ban all advertising, electronic advertising of e-cigarettes. They've tried to ban sales to minors. They've tried to do these incremental steps that many countries, in fact, are now, those that haven't banned it, are trying to play catch-up and sort of do these kinds of things. So that's what China is doing at the moment. But the fact remains is that China has a major financial investment in the vape industry, and that makes it particularly complex, particularly as the control of vapes is now with cigarettes in the national monopoly. There was a big debate as who should control the vaping industry, but anyhow, it goes with cigarettes in the Chinese National Tobacco Corporation, which is a government department.
Okay, so it would be fair to say that in China, this is the tobacco industry, the same industry that is involved in producing tobacco.
And that's pretty true around the world, to tell the truth. There used to be, the very beginning, there were some vape companies, but they've all been absorbed by big tobacco.
I was interested that when China restricted flavours and disposable e-cigarettes, suddenly the market went wild here. It was like it was all being exported rather than sold somewhere else. And our youth uptake rates really soared. And we are now seeing addiction being created amongst young people that weren't at risk of smoking.
Yes, absolutely. And I think the tobacco stroke vape stroke nicotine industry is really trying to actually attract a new genre of young people. I mean, we know that traditional smoking now, the kids who go to university are much less likely to smoke. Those who work on the construction sites are the people who are smoking. In all of the rich countries, it's becoming a habit of the really poor, disenfranchised, illiterate, and people without jobs and so on. But with vaping, they are marketing it as a very trendy product of young men in suits and waistcoats, you know, sort of sharing it with their elite friends. Now, they do advertise cigarettes like that a bit, but what you're seeing in countries that still allow advertisements for vaping, it's never directed towards middle-aged people, middle-aged smokers who want to quit. It's always directed at teenagers, but they are smart and trendy. That's the market that they're trying to actually attract. And I really worry that, you know, it could be countries that are still allowing e-cigarettes on the market until they actually ban them, that they could be creating a slightly different market from the people who are smoking cigarettes today.
It feels to me almost as if the playbook I see in the UK is the playbook that was playing out for tobacco in the 50s.
Yes. It is. It is. The same tactics. And America in particular allows advertising of vape products. They are all towards young, trendy people who are at gigs and raves and sporting and healthy, beautiful, glamorous young people. The whole advertising focus is actually on young people. So what the tobacco industry say, which is we want these to help people quit, I have to say I haven't seen one single advertisement directed towards a 60-year-old who wants to quit smoking. None. All of the advertisements are directed towards the very young children, and I do mean children, very young people, in order to create a vape market. I mean, it doesn't match. It's a hypocrisy with a line right down the middle. They are not advertising to help people quit. Not at all. I haven't seen one. There may be one somewhere in the world, but I certainly haven't seen them, and I've seen a lot of advertisements for vapes.
It does concern me that when I speak with colleagues from emerging economies, low and middle income countries, what's happening in the UK is being used to put pressure on their governments to allow the market for e-cigarettes and tobacco-related products. It feels like almost the UK is a poster child for e-cigarettes in other parts of the globe where there's more caution.
I think it's mostly England, to tell the truth, rather than the other parts of the UK. And they have certainly advertised and promoted and promulgated the idea that e-cigarettes are the panacea and that they are to be used to help smoke. Well, to be used, and I think because of this explosion in England of young people using vapes, I think there is a bit of a retraction now. I think that what they're saying is, oh dear, we've got all these scores, hundreds, thousands, if millions perhaps, of young people using vapes, and we don't want them to use it, but we still think it's useful in pregnancy, it's useful to help people quit. That the mantra has actually changed over the last 10 years. But at the same time, I mean, it's not just really recognising that, as we did at the beginning in Hong Kong, you can't put a trendy product like this on the market and not expect young people to use it. This could have been forecast 10 years ago as to what would happen if vapes were allowed on the market. So what we are seeing is that people from Canada, from New Zealand, and I have to say from England as well, in an international scene are all sitting on countries, so to speak, and attacking countries that are trying to ban the product, in addition to the actual vape industry itself. You've got people who are harm reductionists who are giving these countries a pretty hard time as well.
At population level, from the figures I see in Scotland, we are not seeing harm reduction. We are seeing increased nicotine use in a new generation, and we're not seeing a beneficial effect on older smokers.
I think that's around the world, that's what the data shows. And we've even done studies now in Asia. We've done studies, does it help people quit? And it doesn't. And what does it do about young people? And it's not just WHO, it's not just Scotland that say this, but we found studies done in Asia show that if you start vaping, you've never smoked anything in your life, but you start vaping as a child or a young person, you are about 3 times more likely to go on to combustible cigarettes. So it's a gateway drug as well. And I think that this is all the rationale that we had behind us when we decided to ban this product. And we asked the Parent and Teachers Association, we asked young people themselves, we did a lot of surveys in Hong Kong. Young people didn't want it, interestingly enough. We're pretty used to having a fairly smoke-free society now. The parents and teachers certainly didn't want it. And then the government just simply felt this was the right thing to do. But I think, interestingly enough, that the interference by the tobacco industry was so great and so obvious and so brutal in Hong Kong that actually I think it almost tipped the scales into governments actually banning it. I mean, I think it was so over the top. It was like shooting yourself in the foot, I think, to start with, bringing in all the, their comrades in arms, so to speak, to try and prevent it going through, and attacking the government as it did, attacking public health policy, which it's not supposed to do under Article 5.3 of the WHO Framework Convention. It says the tobacco industry has no seat at the table when policy is being discussed. But we had legislators standing up saying, I am the voice of the tobacco industry in LegCo. It was so overt, is what I'm saying. It was so extreme, the pressure on government that was put on government, that I think it was counterproductive for us. But I agree with you, for many other countries that are perhaps not as robust in terms of their public health policy, or perhaps are less corrupt, or not, well, I think our government's pretty non-corrupt, but countries that could be corrupt or persuadable, so to speak, I think they've had a really hard time. And even countries that have banned it are under pressure to reverse that ban. To my knowledge, that hasn't happened in Hong Kong, but I certainly know it's happening in other places in Asia. So I think this just means that these vapes are the future of the tobacco stroke nicotine industry, and they are fighting tooth and nail to try and keep them on the market. But all the evidence shows that we probably made the right decision. They don't seem to help people quit in population terms, and this explosion of young people taking it up does not augur well for the future. So I think Scotland is quite wise to be really cautious about this problem. You haven't been able to ban it, but really to try and do everything else you can to get this epidemic in check before it just is, uncheckable.
Yeah. So the discussion at the moment is a 4 nations UK approach, and there's talk about plain packaging, there's talk about restricting flavours. I'd love to see them restrict the promotion and advertising in line with tobacco and mandate no added flavourings, because it seems that those are health risks to me.
That, to my way of thinking, that would be an essential first step, actually.
Right. And we're seeing nicotine pouches coming up in terms of being promoted at young people as well.
As soon as we get on top of e-cigarettes, and the world has banned them, as soon as that happens, it'll be something else. And in fact, even looking back historically, this is the 3rd time the tobacco industry has tried to tell us they have a safe product. They tried to do it with cigarette filters, they tried to do it with low-tar cigarettes, and this is time number 3. We have a safer product, and everybody should welcome it and use it. And none of them, as far as I can see, and the experts who looked at it can see, none of these approaches has ever led to harm reduction.
The WHO is very clear. They don't recommend them for adults' tobacco cessation.
No.
There isn't enough evidence.
No, there's not. In fact, almost the opposite. I mean, I think the first bottom line is that the best public health choice at this moment is to ban this product, because even its existence on the market is really contributing to the overall tobacco epidemic. And some countries would find that hard to do. So I think Plan B, and it's definitely only B, it's not Plan A. I think Plan B would definitely be to at least get it under some kind of control, like there are on cigarettes, to ban it where smoking is banned, to put a warning on it in some way, shape or form, not impossible to do, to actually regulate and require identification of what's in them. We have no idea what are in these products. And I don't think a week goes by when I don't have an email of a new health hazard from these products, whether it's cancer, whether it's the genes, whether it's heart, whether it's fires, whether it's explosion, warnings such as the fact that these vape sort of containers have embedded software in them. I don't know if young people actually realise that. They're all worried about big government sort of following you. They should be jolly worried about the tobacco industry following you with the software embedded in these products. So I think to just explain why we did it in Hong Kong. So I think it's now almost 2 years since the law went through, and certainly I don't think anybody in the government in Hong Kong feels it was a mistake. We always said at the time we banned it, if evidence emerges in the next 5, 10, 15, 20 years that actually there is any advantage to these products, we can always reverse that law. But as I said at the beginning of the interview, once you let this genie out of the bottle onto the market, very much more difficult to then get it contained.
As it was with tobacco.
As it was with tobacco, that's right, yes.
Well, thank you for joining us today. Thank you for all the work you continue to do to inspire us in Scotland and internationally. And it's been a pleasure speaking with you.
Well, thanks to Ash Scotland and indeed the Scottish Government for helping us with this, indeed. Thank you.
Thank you.